this episode of Bondi Vet.
Once you know what has to happen today, I'm not so sure you'll be so keen on these kisses.
Can Chris find a way to save the much-loved Bucky?
It is frightening what could happen if it turns out to be cancer.
Okay.
Has a deadly paralysis tick attacked these three brothers?
There's always a concern that something dreadful happens and they don't make it. And then you've got to go back and tell the children.
Hey, where are you going?
Will these dangerous babies give Tim the slip?
They're fully loaded with venom. Back in there, Houdini.
And a case that will shock you. Could a misplaced microchip have done this to Mitzi?
To see her when she twitches, so scary. There's got to be a reason.
You make my world a better place.
Yes.
We'll get you walking again soon.
That's good.
I can't depend on you.
Hey guys, how are you?
Chris is in Coffs Harbour in northern New South Wales. He's making a house call to one of his most lovable patients.
Now Bucky's a bit of an old time and the staff here are pretty concerned, so it's time for a checkup.
Microchip massages, haven't it?
3 years ago, 42-year-old Bucky just survived throat cancer. Now his longtime trainer and best mate Greg is worried the cancer has returned, this time in his mouth.
What are you saying about me, Greg?
Chris, hey.
How are you?
Mate.
Good to see you. Hey, Buck.
It's been a while.
Hey, buddy.
It's good to see you, Buck.
How you doing? Hello. All right.
It is frightening what could happen if it turns out to be cancer.
All right, Buck. You got the jealous type, are you, Greg? Come, Buck. Here you come. Here you go, buddy. Hey.
How's that? How's that?
Bucky was just 6 months old when he was found on a sandbank, badly lacerated, sunburnt, but he was brought in here and nursed back to good health by 19-year-old Greg. They've been together for 42 years. Greg doesn't use the word love, but it's exactly what it is.
It was really hit me hard when I discovered that was cancer in Buck's mouth. I was there for him to support him and give him that encouragement to fight on. And without that there, I don't think he would have made it.
I can see what you mean, just on the front of his tongue and just underneath his tongue he's got a few little lumps.
Yeah.
So I guess the hope would be that those lumps are just from fish, just little spikes from the fish have gone in there and caused a little infection, but obviously the concern is with him having cancer a few years ago that maybe something's come back.
Yes.
The average life expectancy for a dolphin is about 20 years. At 42, Bucky is already a special survivor. Blood tests and biopsies will confirm whether Bucky faces another huge challenge.
When you realise that Bucky is 42 years old, it puts him at an increased risk of getting something nasty. So you hope that it's not bad news, but you've got to be so nervous.
In the New South Wales country town of Maitland, 16-week-old Mitzi is getting ready for her life-changing journey to the Bondi Referral Hospital, SASH. She may appear to be a normal kitten, but there is something terribly wrong.
To see her when she twitches and if she has a seizure, it's so scary.
Hello, Puss Puss.
It's like having a baby again. She's very, very loving.
Mitzi had a tough life from day one. Dumped as a baby, she was taken in by Melita's daughter Jessica and her partner Chris, who run a private rescue shelter for cats. When they took the orphan in for a routine microchipping, Mitzi's luck took a turn for the worse.
Pretty much as soon as the needle went into her neck, she had a really violent seizure.
She spent about a week and a half completely paralysed down her left side. So she sort of eventually, she started getting a little bit more movement, but at first we were hand feeding her and dripping water into her mouth with a syringe.
Can you hear her purring?
Melita believes there is a link between the microchip and the kitten's serious issues.
Vets that we've taken her to have all said, oh no, it couldn't possibly be the chip. Never heard of it, couldn't be the chip. But I don't know, there's got to be a reason. She right? She gets really upset coming outside. She's not used to it, so she gets really scared.
Do you want your mum?
Show me.
Where's your mummy?
Now she and Jessica are on their way to Sash to see specialist surgeon Andrew Marchevsky.
I'm actually scared that the chip is in the wrong spot. And I need to find out so that if it is, we can move it.
Now, once you know what has to happen today, I'm not so sure you'll be so keen on these kisses.
Back at the pet porpoise pool, Chris is about to find out whether 42-year-old Bucky has been struck down with cancer for the second time.
No, it's serious. Hey, it's serious work. And you're doing your best to make it less serious, I know, but no, don't try this. Bucky.
A bit nervous. I'm staying positive. There's not going to be anything, but you never know.
How's he doing with the shows? I mean, he's getting on in years.
Yeah, he's getting on, but he's not showing any signs of slowing down. He's a really strong animal, and the excitement of the crowd, spurs him on.
This was Bucky in action only 2 hours ago, doing what he loves most.
Let's give them a big round of applause.
He likes to be the centre of attention, like any star.
The type of cancer that Bucky had was a squamous cell carcinoma.
Hey, Bucko, you ready for this, old mate?
They're renowned for being very tricky to remove entirely. It looked like the job had been done incredibly well, and it hadn't shown any signs of recurrence. But recently, these lumps have appeared. Everyone's justifiably concerned. So what I guess I need is just for him to have his mouth open as wide as we can for as long as we can.
Yeah, we can manage that, can't we, Buck? So we just give it a go first. Open wide, Buck.
Yeah, see, that's just too rough there for my liking. I mean, it's normal for them to have little undulations in this area around the base of the tongue, but that one's just a little bit raised there.
Yeah.
In amongst the rough patches are some little nodules, and they're really what worries me right now, because they just shouldn't be as raised as they are. I'm not saying it is the return of the cancer for sure, but there's enough evidence there to say that we should be worried.
Yeah.
So I really do think we need to take some samples. When you consider that 3 years ago, they nearly lost Bucky to cancer, for me to come back here today with the concern that the cancer's returned, you can understand why it's a really nervous time for everyone here.
Such a good girl.
At the Bondi Referral Hospital Sash, Melita and her daughter Jessica have arrived with Mitzi.
I wonder what he'll say about you.
The rescue kitten is struggling to walk since being microchipped.
I suspect maybe the chip's pressing on something it shouldn't, and yeah, we'll find out.
Just pop on there for me. Hey, Mitz. Oh, dearie me. So what happened?
When she was microchipped, she had a bit of a fit.
Anything else? Was
She was paralysed.
Oh, okay.
She spent almost 2 weeks afterwards. She couldn't move down her left side.
Hey, sweet. Will you go on the ground? Oh, sweetheart, you're all right. Don't panic. Don't panic. What's she going to do? Oh, gosh.
She actually can't walk in a straight line.
Yeah, no, feet are... Mitzi's obviously really unsteady on her feet. One side's much worse. She's got really sort of exaggerated, uncoordinated movements. Back legs, she's sort of all over the place. Really, given that she's so wobbly, we suspect she must have spinal cord injury. I think a CT scan would be the best way for us to go, because we can then get a three-dimensional image of her whole spine and get a three-dimensional image of exactly where the chip is, if that's causing a problem, and then go from there.
I'd really like to know for sure if we can either prove or disprove it.
Okay, well, let's get her admitted.
It will be an agonising wait for Mitzi's devoted foster family.
She's got a lot of love to give to someone. She's so affectionate. I just hope it all works out for her.
And hold still here, Buck.
At Coffs Harbour, Chris is continuing his investigation into the disturbing lumps in Bucky's mouth.
Still, Buck. That's it, buddy. The first thing I need to do for Bucky is take a biopsy of one of those lumps, send it away to a lab to be analysed and check if it is cancer. That's it. Okay, yeah, got it.
Yeah, we'll sort things out for you, bucko. Yeah, I'll find out what's going on. Yeah, you'll be right, mate. You'll be right. I'm with you, buddy. Yeah.
The relationship between Greg and Bucky is pretty extraordinary when you realise that it's been going for 42 years. A marriage would be extraordinary if it lasted for that long. Friendships don't last for that long. It is just off the charts.
You'll be right, mate.
So the cells that are on this slide should really be able to tell us if Bucky's cancer's returned. Hey, Aaron, could you send this off to the lab straight away? And just tell them it's urgent. No worries. Great. Thanks, mate. Cheers.
Back at Sash, Catherine has arrived with 3 miniature poodles.
This here is Boots, and these are his brothers, Chopper and BJ.
But it's 2.5-year-old Boots that Catherine is worried about.
He was not very well last night, and then this afternoon when we got home I found a little lump under his neck, rolled him over, and there was quite a big looking thing.
Catherine is concerned that what she found is a deadly paralysis tick.
Come on, guys.
All 3 poodles have been together and need to be checked for the life-threatening parasite. But Boots appears to be the only dog affected.
Oh, that's a big crater. When did you first notice that something was not right with Boots?
Probably last night he was vomiting up his meals, and since then he hasn't kept anything down.
Emergency vet Lisa Chimes is convinced that the tick toxin has already begun shutting down Boots' system.
Boots is definitely showing signs of tick paralysis. His back legs have gone, he's really wobbly, he's falling all over the place, and if we don't treat him straight away, he could get worse very quickly. He's going to need to stay in hospital. We're going to give him some sedation, clipping off all his hair to make sure there's no other ticks.
How do we check that they don't?
The only way to know for sure is to give them a haircut too.
There's always a concern that something dreadful happens and they don't make it. And then you've got to go back and tell the children.
Oh no, it's a little sting. Hey, brothers.
While BJ and Chopper are admitted for observation, Lisa starts life-saving treatment on Boots.
We're going to give Boots some sedation now because when an animal has tick paralysis, they can't use their legs properly. They have difficulty breathing. They don't really know what's going on. It makes them really, really stressed. So we give them some sedation to take the edge off things.
With the sedation now taking effect, Lisa can begin administering the tick anti-serum.
He's certainly a very sick dog right now. Oh, sweet pea. You're a good boy. Now that we've given Boots the tick anti-serum, it's really important that we take some x-rays of his chest, because what can happen with tick paralysis is it can cause their esophagus, their food pipe, to dilate, and that can make them prone to inhaling their vomit. So it's really, really important that we know what's going on. And it does show that he's got a condition called mega esophagus. The tick has basically paralysed his esophagus. We don't feed Boots anything because anything we give him by mouth is going to just come straight back up and put him at risk of pneumonia. So he's going to stay on a drip until that mega esophagus gets better, and that could take days.
Go ahead, Lizzie.
Tim, I have an unexpected delivery in the venom room. You might want to pop up. I think you're going to want to see this.
This sounds pretty interesting. I'll be a few minutes, but I'm on my way.
I was not expecting that.
What do you got?
At the Australian Reptile Park, there's a surprise waiting for General Manager Tim Faulkner in the snake house.
Very cool to see that.
Keeper Liz has discovered that their tiger snake has just given birth.
How many?
Well, I've counted 10, but I stopped counting after that.
All right, well, I'm going to split them all up.
Are you going to be right?
Yeah, there's only 10 little tiger snakes, no worries.
Okay, see you later.
See ya. It's critical now that I get the babies away from Mum. Mum's job is done. She's done the hard work of mating, carrying these little babies inside her. But at this point, Mum goes in one direction and the babies go in the other. They can't do that in there, so it's my job to help. Tiger snakes are the 4th most toxic snake on Earth. That's pretty impressive. They live right along the east coast of Australia, responsible for a lot of bites and sometimes deaths, so I've got to be pretty careful. Hello, Mum.
He can get started with his full body shave, and then we've got 2 others lined up for their shaving as well.
At Sash, Boots is critically ill after being bitten by a paralysis tick. The miniature poodle is being shaved to ensure there are no other ticks attacking his system.
Who wants to be checked next? All right, we'll take you, BJ.
As a precaution, his brothers Chopper and BJ are also being checked to ensure they aren't carrying any of the deadly parasites.
BJ's been in the same area as Boots, so even though he seems fine now, we might still find a tick on him and he could still develop signs of tick paralysis. So we've got to keep a close eye on it.
Whoa, it feels funny, doesn't it?
All right, Chopper buddy, it's your turn. Come on.
Oh, that sounded sick.
You found another one?
Yeah, wow, it's really far in.
So while we were shaving Boots, we've just found another tick on his ear, so it goes to show how important the shaving is.
Oh no, it hurts. Good boy.
Okay. We got it, baby. We got it. If we hadn't found the other tick, the tick anti-serum wouldn't be working as effectively because this tick would still be injecting toxin into Boots' system.
While Boots' siblings, Chopper and BJ, appear to be clear of any ticks, little Boots is struggling as the tick toxin continues to attack his system.
At the moment, we're pretty happy that Chopper and BJ are tick-free. They're not showing any signs of tick paralysis, which is great. But certainly ticks can hide anywhere, so we're going to keep checking them to make sure we haven't missed them. Boots could certainly get much worse. His breathing is already looking a lot more laboured than it was when he came in, so we have to keep a very, very close eye on him. You're okay, Boots. You're all right.
So, Greg, I just want to use the ultrasound just to check out his lymph node, which is just sitting in this area here.
Okay.
If it's a normal size, then we can be more confident that it doesn't have cancer. All right.
Just hold on, just relax, mate.
There you go, mate. Doesn't hurt.
At the Pet Porpoise Pool in Coffs Harbour, Chris is now performing an ultrasound on one of their major stars, 42-year-old Bucky.
Nice and still. Just relax, mate.
The Dolphin survived throat cancer 3 years ago, but now new lumps have been found in his mouth.
Nice and calm.
If this cancer was going to spread anywhere, it would spread straight to that lymph node. So this is a really crucial part of working out what's going on with Bucky. Okay, yeah, we've got one now. All right, so we've got this little bean-shaped area here. That's our lymph node. Just running some measurements here. Okay, Greg, just want to have a look at this. It's 28 millimetres by 18 millimetres. For him, that's normal.
Oh, that's great.
Yeah,
that's great
that's really
news.
good.
Yeah, that's great news.
So obviously, look, we still have to find out if he does actually have little tumours inside his mouth. But even if he does, I'm pretty confident that they haven't spread. So that's a good result. He's happy as well.
You happy? Hey, you happy? I'm staying positive. There's not going to be anything, but you never know.
I'd still have to take some blood though. It's probably handy while we have him here, just to see how healthy he is.
Yeah.
I was going to use this upper aspect of the tail, just along this white line here. Beats taking blood from a dog. I'm taking blood from a dog. You got the jugular, you got the teeth right there. Here, it's just sitting right here. You're amazing, Buck. All right, we're done.
The bloods will now be sent to the lab for urgent analysis. All Bucky's results will be back within 24 hours.
We just keep our fingers crossed that it isn't the cancer back again.
Bucky, we should have some good news for you tomorrow. I hope. Huh? No promises, mate.
You're right, Titty Tat. You're right. Can I have your little leg?
At SASH, 16-week-old Mitzi is about to undergo a CT scan to find out if a misplaced microchip could have caused spinal damage.
I know, kitty cat. We've got to be careful in the CT with positioning her. Normally we have them positioned on their back with their heads stretched out. We have to be really careful. If she starts moving around a lot, again, could cause damage. So it's really softly. Well, I mean, it's freakishly unlucky. The gap between, bloody hell, the gap between the vertebrae is tiny.
There is now proof the microchip is wedged in Mitzi's spinal canal. The odds of it happening are astronomical, more than 1,000,000 to 1.
No, never seen anything like that. The needle has sort of gone bang straight through that little gap there. I mean, that gap's not even 2 millimetres. We need to take it out. We know that she has these paroxysms of pain or whatever, or seizures, so then occasionally it hits a nerve and she just flips out. So we've got to stop that.
After agreeing to surgery, Mitzi's foster family are coming to terms with the severity of the news.
Do you think that she will learn to walk properly again?
Can I give you a 100% guarantee of that? No, because life's not like that.
It's amazing that it's gone right through the spinal cord. I can't imagine how this poor little thing feels.
The risky surgery will be scheduled for later today, but there are no guarantees of success.
There could be a dirty big blood vessel sitting right around it. We take it and it bleeds like crazy. It's not likely, but it's possible. You know, worst case scenario, she will be permanently worse.
Look at them all. Hello, Mum.
At the Australian Reptile Park, Tim is about to take on the dangerous task of separating a tiger snake from her bundle of babies.
Mum looks great. You know, the belly's a bit floppy and she needs a drink and a feed. Now, it's interesting with baby tiger snakes because they look so cute. But in actual fact, they're fully loaded with venom. Their fangs are only small and, you know, maybe they wouldn't punch right through the skin, maybe they would. I'm not going to take any chances on wearing gloves. Roughly in 4 or 5 days, they're going to shed their skin. They do that straight after they're born. So what I'm going to do is put each tiger snake in its own little container. I need them nice and moist. I'm going to put a little bit of water and paper towel, let them have a shed, and they'll have their first feed in a couple of weeks. Hey, back here. Back in there, Houdini. Back here, mate. Back here, please. Hey, where are you going? There you go. Hey, you, come here. Whoa, they're slippery and they're quick, and I'm using a glove that's safe, but it's awkward because I can't feel them properly, and yeah, they're tricky. This is won't stay in gym. Stay there, stay there, stay there. Lizzie, they keep jumping out of their containers.
Oh, I get it. So you need my help now.
Yeah, very funny. Yes, please. Can you come back up?
No worries.
Come on, buddy.
Hello.
I don't really need your help. I just thought you might like to.
Yeah, right, okay. Haven't they got beautiful markings on them?
There you go, pal. The reptile park's role is to extract venom from these snakes that we send off to the Commonwealth Serum Laboratories, and they make any venom. These babies to us are priceless because they now will be incorporated into the venom program and help save lives.
Before Mum goes back into her enclosure, she too will be making a contribution to the venom program.
Whoa, look at that. 2 fangs, couple of drops. Yep, we've got quite a good little amount in the bottom there. The average tiger snake milking has enough venom to kill maybe 4 grown men. Okay, thank you. If you're bitten by a snake in Australia and you receive any venom, there's a very good chance that any venom was made from these snakes. Those few drops could save someone's life.
We've done a CT and we've actually found that Mitzi's got a microchip sitting in the middle of a spinal canal. This thing could be sitting in or on a blood vessel, and if we move it, take it out, she could bleed out.
At SASH, Specialist Surgeon Andrew Marchevsky is about to start the critical surgery on Mitzi.
Small possibility, but a real possibility is that we could make it worse. And I guess that's where we're taking a risk, but I think we have to take a risk because she's intermittently, I think, incredibly painful, and that's what these seizures are. They're just paroxysms of pain. We good to go? There's quite a lot of blood vessels in the muscles of the neck, so especially with this little cat, we've got to be really careful not to lose too much blood because she really doesn't have a lot to spare. I guess the other thing that we've got to be really careful of is that as we're dissecting down, we don't dissect down directly onto the chip and maybe push it in further or cause more damage. So it's just got to be patient and meticulous. We're just starting to peel the muscles away. Not sure what I'm going to grab it with.
Finally, the critical moment has arrived, removing the microchip without causing any permanent damage.
Let's see if we can grab it. Just turn that sucker off. Thanks.
Waiting in reception, Mitzi's foster family are hoping they've made the right decision.
Really anxious. Just want someone to come out and tell us that they've got it out and that everything went well. Yeah. I guess no news is good news for the moment.
I can just see the tip of it, and I think we should be able to just grab it and pull it out. So there we go. Bingo. That came out really nice.
Andrew must now reposition the microchip.
We've re-implanted the chip into just under the skin to where it should be. It's really important that animals are microchipped. It is such an important way of identifying them and making sure if they get lost, they get their homes, and it's part of responsible pet ownership. I still say this is a 1 in a million sort of risk. She's just really unlucky. I'll be hopeful that we haven't caused any more damage because it's come out pretty nicely. We're really careful, so I guess we'll know when she wakes up. Hey, chitty chat. Don't look at me like that. Hey, we're just doing the good stuff. I know you're really keen to see her, but I think you'd be better just waiting until tomorrow, and then you can see how she's going then.
There'll be no visitors for Mitzi tonight to make sure the kitten stays as calm as possible.
I think we've given her the best chance of getting back to totally normal. But, we're not going to know tomorrow, next week, or even next month. Time will tell. We did all one. Oh, sure.
Hey, have Bucky's results come through yet?
Yes.
The next morning at the pet porpoise pool in Coffs Harbour, Bucky is enjoying some R&R, while longtime friend and trainer Greg is working with Daisy, the sea lion.
Open wide.
Thank you.
The results of Bucky's tests have been fast-tracked.
Yeah, it's not really what we're hoping for. We got Bucky's results back. No, it's not good. So it has come back as being cancer.
Really?
So it's saying it's a squamous cell carcinoma. So it's the same thing you had before, just a recurrence of it. So I'm sorry.
Doesn't sound good.
No.
I was praying and it turned out to be nothing serious. But, wasn't the results I was hoping for. But it is what it is. And, we've got to accept that and deal with it the best way we can.
You right?
Yeah, I'm a bit shocked, really. Yeah, I wasn't expecting it.
Telling Greg, it's a very hard thing to do. You know the history between them, you know those 40-odd years of connection they have. So you're telling him essentially that his best mate is seriously ill. It's not nice.
Come on, mate. Hey, look, hey. Sorry to let you know, but we've got some bad news, mate. It's not good. Hey, it's not good, but we'll be right. We've been through this before with Buck, and he's strong. I'll stand by him and give him all the support I can.
Hey Mitzi, how you doing? You're pretty good considering.
At SASH, it's only been 24 hours since surgeon Andrew Marchevsky removed a microchip from Mitzi's spine. There was a risk the operation could cause the kitten more damage, but early signs are positive.
I thought she'd be worse. When you're taking something away from the spinal cord that's been sitting there a while, just that's what happens. She's actually better. I couldn't be happier.
We haven't made you any worse. That's a good thing. Whoopsie. There you go. You're looking a little bit better today. That's a bonus. Hey, I think you're more comfortable.
And she's still wobbly, she's still weak, but that'll get better. And she's got age on the side. And when you're young, you can recover and recuperate from trauma much more easily, and she will.
Okay, you're more active. Hey, you're more active.
Come on, we'll get your mums to have a look at you.
Andrew is now finally relenting and letting Mitzi's foster family in for their first visit.
She's looking really good.
Is she?
Yeah, I think probably better than I thought she might be.
That's good.
So I think you'll like what you see.
Oh, good.
Come have a look?
Yes, please.
Yeah, really?
I'll try and keep it away.
In all seriousness, she's just got a look of relief on her face. It's like, oh, and now I can do stuff. Yeah, so no, and she has surprised me.
I've been spent all day preparing myself for her to be as bad as she was when this first happened. But she's doing really well. So much better than I expected.
I think she's actually going to be quicker than you think she's going to be. Just be wary of that.
Despite the impressive recovery, Mitzi will have to stay in hospital for a few more days for observation.
Amazed that she's as good as what she is. I fully expected her to be, I don't know, either paralysed or, I don't know, flat on her back for a week or so. So to see her up and walking around is amazing.
All right, hey Buck, so this is what we're going to use. So there's liquid nitrogen in here. So I just need him, just as he was before, just with his mouth nice and wide open and still. That's the most important thing.
Okay, all done. Yeah. Oh.
Impatient?
Yeah, impatient. He's ready to go.
In Coffs Harbour, Chris is about to begin treatment on Bucky's mouth cancer.
What I'm going to do is use cryotherapy. So essentially we're going to be freezing these lumps off.
It's okay.
So you can see how that lump's turned white. The reason for that is that all those cells are frozen. So we wait for them to defrost, and then if you hit them over and over again 3 or 4 times, then you have every chance of really killing off that cancerous tissue. Doing good, Buck. You're doing real good. A little bit longer, mate. A little bit longer. There we go. We're done, mate.
Hopefully this treatment will give the 42-year-old patient another lease on life.
That treatment's gone really well, and it's gone really well for one reason, and that is that Bucky stayed so incredibly still. Here you go, mate. Thank you, buddy. Thank you. You're amazing. Huh? You're very good. Very brave again.
Yeah, he's one of a kind, there's no doubt about it. He's a really unique dolphin. He's got so much trust and so much to give. He really amazes me sometimes.
It's the best reaction to cancer treatment I think I've ever seen. Is he for real? I didn't want to be the person that came in here today and told Greg this bond, this partnership of 42 years was coming to an end, but after seeing Bucky's response to his treatment, I've got no doubt that he'll be showing off for a lot more years to come. You're welcome. You're welcome. I said it. Anytime.
Quite ready to come home. Right, your brothers are ready.
Back at Sash, 2.5-year-old Boots is in a critical condition after being bitten by 2 paralysis ticks.
You're still pretty sick.
But the prognosis for his 2 brothers, Chopper and BJ, is much better.
They're troublemakers. We've had them in overnight, we've looked for ticks, haven't found any, which is great. So poor Boots is the one that really copped it. He had 2 ticks on him and he's really not doing that well. Say bye to Boots. Say bye, Boots. Come on, BJ. Come on, Chopper. Oh my goodness.
Oh, look at you.
Catherine and the extended family have come to take the much-loved poodles home.
Hello, Chopper.
So these guys are looking okay, but now the most important thing is all of you, especially you guys, because I bet you guys pat them the most, is to look for ticks every single day. Yes, keep an eye out. The boys are very happy, they're feeling good, they're actually really lucky. So they're on their way home, but we're still left here with Boots, and he's a really sick little dog, so we really need to keep on monitoring him. He still could get worse.
At Sash, it's been 3 days since the risky surgery to remove a microchip that was accidentally lodged in Mitzi's spinal canal. But finally, the tiny cat is ready to begin her new life.
So is she right just to run around and do what she wants to do?
Oh, look, with any major surgery, you should take it easy for her. So if you can limit how much charging around she doesn't. You know, she's not going to do any damage to a spinal cord, but she might sort of cause some bruising or swelling, which you don't want. So, yeah.
For the foster family who used up all their savings to pay for the orphan's operation, it's a huge relief.
We could have left it there because of the expense, but if we'd have left it there and something horrible had happened, it would have been terrible, but it's so worth it, seeing her like that.
She's going to need a really special owner because, for all sorts of reasons, just practical ones, because she's going to need a fair bit of looking after for a few months yet. And also for emotional reasons. They've put a lot of emotional energy into her.
Bye, thank you. Thanks.
I want to make sure that she gets the right home, and I think that's really important for them and for Mitzi.
Joining us here today, Dr. Chris Brown. Let's give him a big welcome to the show.
Thank you.
In Coffs Harbour, Chris is keen to check on Bucky's progress. The Dolphin underwent cancer treatment just a few days ago.
I really had that coming, didn't I?
Now, Bucky would like to say a lovely big thank you to Dr. Chris.
What you got to say, Buck? What do you... Wow. Wow, you're really lingering. Thanks, Buck. Ready, Buck?
Oh,
That's a
great
good one.
kick. Bucky's underneath it. What a take from Bucky.
He got it.
No video. Now we're going to find it off this end. Okay, so
To see him come out and perform and put on what was an extraordinary show, it's amazing. He's such a trooper. He's got such a strong spirit and such a desire to make people happy. He and Greg have got a lot of happy years ahead, I'm sure of it.
We'll keep working together and keep that strong bond and that strong relationship going. We'll be here together for a long while yet.
Hey, Boots. How you feeling, little boy? Oh, you're so much stronger.
As for Boots, he's finally winning the war against the deadly paralysis tick that was attacking his body.
Boots is looking fantastic. He's strong in his legs. He's breathing normally, so everything's really doing what we want it to do. And now we just need to take an x-ray to see if his dilated esophagus has improved. And if it has, then we can feed him. And if he eats normally, then he can go home. See, Boots, it's all normal. It's all gone, all better. You're a good boy. Okay, Boots.
anyway.
Hey, you want something to eat now, honey? Look what I got. Good boy. He's come along in leaps and bounds. He's stronger, he's feeling better, and he's actually a lot more relaxed, a lot less nervous, and I think he's really excited to go home.
Waiting in reception is Catherine and Boots' fan club. Brothers BJ and Chopper have also come along for the reunion.
Come on, Boots.
He looks so well. You'd never know.
Apart from the haircut.
He's so cute, Bootsy.
Bye. Good luck. All the kids and Kathy are delighted to have Boots back home. They're so excited. I think they just want to pamper him and give him lots of TLC till he gets back on his feet.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.